And we're back for day 2 of our dental anatomy marathon. Yesterday we looked at the maxillary central incisor. Today we're going to be looking at its neighbor, the maxillary lateral incisor. Hello, I'm Dr. Clara. I'm a practicing dentist and your new dental study coach. I'm taking mountains of textbooks and information and turning them into short, easily digestible videos so dental students like you can have some study resources. Speaking of resources, go in the description below, click the link, and steal my 5-step tooth identification cheat sheet to help you identify teeth on your exams. There are 2 maxillary lateral incisors, the right and the left, and those are numbered 7 and 10 using the universal numbering system. The maxillary lateral incisor is one of 4 types of incisors. Like all incisors, it has an incisal edge and no cusp. The maxillary lateral incisor is located just distal to the maxillary central incisor, being the second tooth from the midline. The maxillary lateral incisor has the similar proportions and features as the maxillary central incisor, but it is relatively smaller and more rounded, except the root, which is longer.
Attention dental students. On tests, they love to compare and contrast teeth. In this case, compare and contrast maxillary lateral incisors and maxillary central incisors. Compared to the maxillary central incisor, the maxillary lateral incisor has a smaller crown, a more rounded crown, more prominent lingual features, including the cingulum, marginal ridges, and fossa, and a longer root. A good test question could be, true or false? Compared to the maxillary central incisor, the maxillary lateral incisor crown is smaller and more rounded. Compared to the maxillary central incisor, the maxillary lateral incisor root is shorter. False. The root is longer. Which incisor has the most pronounced cingulum? The maxillary lateral incisor.
The function of this tooth is the same as all incisors: to cut, bite, and shear food, support the lips, help with aesthetics, and help with speech. The maxillary lateral incisor erupts at ages 8 to 9 years old, and the root completes 3 years later at 11 years old. The initial sign of calcification is at 10 to 12 months. Let's look at the facial of the maxillary lateral incisor. The crown of this tooth, like all incisors, is trapezoid shaped, with the larger base at the incisal edge and the narrower base at the cervical line, so that this tooth tapers from the incisal ridge to the cervix. This tooth is taller incisal cervically than it is mesial distally. The crown of the maxillary lateral incisor have the same proportions as the maxillary central incisor, but everything is more rounded. Like all incisors, the maxillary lateral incisor has an incisal ridge and no cusp, so that the incisal outline is flat, with a slight sloping towards the distal, but it is slightly more curved than the maxillary central incisor. There may be 3 mamelons to this tooth at eruption or if it's not in function, which are 3 bumps that you'll see on the incisal ridge that signify 3 different developmental lobes of the facial. The middle mamelon is the smallest. The mesial outline of this tooth is slightly convex, being a little bit more curved than the maxillary central incisor. The mesial incisal angle is a little bit more curved and obtuse than the maxillary central incisor. And the height of contour of this tooth, or the contact point, is at the junction of the middle 1/3 and the incisal 1/3. The distal outline is more curved than the mesial outline. The distal incisal angle is more curved and obtuse than the mesial incisal angle, and the distal contact or height of contour is more cervical than the mesial contact or height of contour, located in the middle of the middle 1/3. The labial surface is convex, more convex than the maxillary central incisor, and there can be 2 developmental depressions: the mesiolabial developmental depression and the distal labial developmental depression, which divide the 3 facial developmental lobes. These developmental depressions are less prominent than the maxillary central incisor. The root of this tooth is cone-shaped with a pointed apex. There is usually a curve to the distal at the apical 1/3 of this tooth. though it is common to have a variation where it's straight or curved to the mesial. And the root of the maxillary lateral incisor is longer than the root of the maxillary central incisor. Now let's flip this tooth around and look at the lingual. The outline of the maxillary lateral incisor is going to be the same as it was from the facial, just reversed. Where the anatomy is going to differ is that the lingual surface is more irregular than the facial surface. Like the maxillary central incisor, there's going to be a fossa. But the fossa of the maxillary lateral incisor is smaller but deeper than the maxillary central incisor. It is still bordered by the same four things: mesially by the mesial marginal ridge, distally by the distal marginal ridge, incisally by the lingual aspect of the incisal ridge or the linguo-incisal edge, and then cervically by the cingulum. The cingulum is centered, unlike the maxillary central incisor where it was displaced to the distal. For the maxillary lateral incisor, there's often a pit in the lingual fossa that is very prone to decay. There's also often a groove in the cingulum, which is prone to decay. And there's also often a groove from the cingulum down the root that is prone to decay. And that groove from the cingulum down the root is called a palato-radicular groove. It's prone to decay and harder to scale.
Attention dental students. They love to test on the palato-radicular groove. Specifically, the fact that the maxillary lateral incisor can be more difficult to clean because of it. The test question could be worded as, which tooth commonly has anatomy that leads to difficulty scaling and potential periodontal problems? The maxillary lateral incisor.
The root and crown of this tooth taper lingually, which means that the mesial distal dimension of the facial surface is wider than it is on the lingual. It gets narrower and narrower towards the lingual. It's going to be a little bit easier to see from the incisal. But first, let's look at the mesial and distal. Here's the maxillary lateral incisor from the proximal views. This is the mesial, this is the distal. The crown is triangular or wedge-shaped with the base at the cervix and the apex at that incisal ridge. The facial outline is convex from the cervical line to the height of contour, and then straight or convex from there to the incisal ridge. The height of contour is at the cervical 1/3. The lingual outline is S-shaped, convex from the cervical line over the cingulum, and then concave from there to the incisal ridge. The height of contour is the cingulum in the cervical 1/3. The cervical line, or the CEJ, where the root meets the crown, has a curve towards the incisal. The mesial curve is more prominent than the distal curve, but both are less pronounced than the maxillary central incisor. The incisal ridge is centered over the root. Another way of saying this is that a line that goes through the center of the tooth is going to bisect both the apex of the root and the incisal ridge. If this tooth has wear facets from use or incising against those mandibular incisors, it's going to be lingually inclined. The root, cone-shaped, straight, with a blunted apex. There's often a deep developmental groove that's quite common on the distal aspect of the root. The root of the maxillary lateral incisor is wider facial lingually than it is mesial distally. Let's look at the incisal view of this tooth. From the incisal, the shape is somewhat ovoid shaped, but there's still that tapering toward the cingulum from the incisal ridge. The mesial distal dimensions are larger than the facial lingual dimensions for most maxillary lateral incisors, but there might be some variation where they're going to be very similar or the same. This tooth is widest mesial distally at the incisal ridge. You're going to see that the facial surface is more convex than that maxillary central incisor surface was, where it had quite a broad curve to it. And then you'll see that the lingual is even more convex than the facial, where that cingulum is, and that cingulum is centered. The maxillary lateral incisor has one root, and that one root has one canal. If you take a cross-section of the root of a maxillary lateral incisor, the facial lingual dimension is larger than the mesial distal dimension. So we've been talking about the typical features of a typical maxillary lateral incisor, but there's going to be a variation. And with the maxillary lateral incisor, there's going to be a lot of variation. This tooth is the second most varied tooth in the mouth, following the third molars. Some common variations that you should know are having a tubercle on the cingulum, having a palato-radicular groove, also called palato-gingival groove, having dens in dente or dens in vaginatus, being cone-shaped. This is called being a peg lateral tooth. So if a patient's laterals are very small and cone-shaped, they have peg laterals. The maxillary lateral incisor could also have that same variation that maxillary central incisors have, being shovel-shaped. This is that genetically determined variation common in Mongoloid races, such as North and South American Indians, where the marginal ridges are very exaggerated and that lingual fossa is very deep, giving the lingual surface a shovel-shaped appearance. The maxillary lateral incisor could also just be straight up missing. In fact, it's the second most likely to be missing, following the third molars.
Attention dental students. Another possible test question topic is the variation that you see in the maxillary lateral incisor. The maxillary lateral incisor is the second most varied tooth after the third molars and the second most likely to be missing after the third molars. Potential questions include: which tooth shows the most variation in form? The maxillary lateral incisor. Which tooth is most likely to be congenitally missing? The maxillary third molar. Keep reading the options that you're given. Don't stop once you see maxillary lateral incisor. If the third molar is an option, that is the correct answer. Which tooth has a variation where the crown is cone-shaped? The maxillary lateral incisor. This is called being a peg lateral tooth.
Well, that's it for day 2 of our anterior tooth dental anatomy marathon. Be sure to subscribe because tomorrow we're going to be going over the mandibular central incisor. Till then, go ahead and check out this playlist of dental anatomy videos. Happy studying. Bye.